You guys mentioned WHO. Clearly the world has never needed that organization more, and yet, it's become a political lightning rod. And listen, there are a lot of things, a lot of problems there too. What can we do to forge a consensus in this country here in the States? I'm sure you've got a lot of people around the world that kind of shaking their head a little bit, but how can we forge a consensus to not make this a controversial issue?
Yeah, so one thing I want to say even before we answer the question is we thought long and hard about whether to speak out in favor of WHO. And we knew we were going to come under attack, but it was the right thing to do. We know this institution. We've worked with this institution now for 20 years. It is not perfect. It's not even close to perfect. But it is what the world set up after World War II to deal with things like this pandemic. And so it is caught now between the tensions between the United States and China, those geopolitics. But we felt as philanthropists, it was incredibly important to put our voices behind a partner we know to be true but imperfect. So that is why we spoke out. As to what others can do, I don't know, do you want to take that?
Well, at some point there needs to be a responsible plan for how the U.S. cooperates with other countries about health things. WHO is involved in smallpox eradication, and the U.S., our relationship with WHO is key there. Polio, we are close. We're down to just a few countries. That's very much WHO, where both our money, U.S. money, other countries give to that. And so, you hope that in terms of protecting people's lives, there eventually is a serious discussion about how the world works together. Even this issue of getting the vaccine out, we're hoping the U.S., in the same way it did step up for smallpox, malaria, and polio, that it steps up like it and HIV, that the U.S. does step up. And so the Congress seems very interested in the U.S. not being so weak that it's other countries that figure out these global problems. It creates a vacuum. It, erodes the kind of relationship and admiration and self-confidence people have had in us as a country. And so, I just say, rationality will reappear from someone at some point, and the U.S. will get engaged in its generosity and the world body that is charged with pandemic coordination.
Yeah, I think one thing it's important for the philanthropists on the phone to also know is just that WHO, as Bill said, is on the front lines of eradicating polio. Well, that's important for polio, but why else is it important? Well, when Ebola broke out in East Africa and it made it to Lagos, as we know, one of the most populous cities in the world, and Ebola came to Lagos, immediately those polio resources that WHO had, we had funded, Rotary had funded, immediately those resources got flipped, and that polio clinic got flipped to be an emergency response clinic. And they immediately went out and did all the contact tracing and quarantining. If that hadn't happened, we would have seen so much Ebola be flown to New York and San Francisco and spread all over the United States. So the world got lucky on Ebola. There are other hemorrhagic fevers out there. And so if we don't have a functioning WHO, you're not going to see an immediate response like that.